Hi, in this video I'm going to discuss the November 22 INI CET recall questions, and if you all think that some of the information or questions I have missed out, then please mention in the comments below. Also, this video will be like a quick revision before the main CET entrance examination. So the first question here is HIV positive patient with diarrhea, stool examination, acid fast stain shows oocyst of 8 to 10 micrometer, which was asked in morning session, or 4 to 6 micrometer, which was asked in the afternoon session. The options are as follows: Cyclospora, Cryptosporidium, Cystoisospora and Microsporidium. According to the sizes of these cysts, you have to select the correct answer. Cyclospora is 8 to 10, Cryptosporidium is 4 to 6. Next question is: forest worker gets injured on forearm and develops first macular, then nodular lesions. Biopsy shows the following findings. True statement, you have to pick of these four options. That is, these bodies are fungi, engulfed by macrophages. Infection does not involve fascia, tendons and muscles. Dimorphic and found in yeast form in the body. And angioinvasion in immunocompromised patients. Now, if you see the picture at the right hand side, you will notice that these are typical copper penny bodies, or also known as sclerotic medlar bodies, with septations, if you observe properly, the copper color bodies. Now, the diagnosis here is chromoblastomycosis, because these medlar or copper penny bodies are typically found in this fungal infection, which is nothing but subcutaneous mycotic infection. The word subcutaneous itself tells you that the B option, infection does not involve fascia, tendon and muscles, is a true statement. But let us rule out the other options one by one. These bodies are fungi and they are not something which is engulfed by the macrophages. Dimorphic fungi are different. There are 6 in types and you should know them, so this is not one of them. And angioinvasion in immunocompromised patient is caused by something known as aspergillus and not chromoblastomycosis. So there's your correct answer. Here we have the next question is Parvovirus B19, all are true except. The options are non-immune fetal hydrops, red cell aplasia, SLE non-erosive arthritis and slapped cheek rash. Now let me tell you something about Parvovirus B19. It causes erythema infectiosum, which is also known as slapped cheek disease, because of the typical rash on the baby's face, or fifth disease, red cell aplasia, non-immune hydrops fetalis and polyarthropathy in adults. So if you know all these facts about Parvo19, you can easily rule out in this case SLE is not at all associated with Parvovirus B19. This next question is very interesting. Inclusion body in neutrophils is seen in which Rickettsial diseases? Options are Rickettsial, Akari, Anaplasma and Ehrlichia. Now this question was asked even in the form of a patient presenting with fever, headache, malaise, showed monocytes and morula. It's just that in the previous question it was neutrophils and here it's monocytes with the same option. There's an arrow in the image which is pointing out at that particular morula, and they are saying what is the likely cause. Now let me tell you something about the disease Ehrlichiosis. Ehrlichia causes ehrlichiosis, and it is of 3 other types: Scheffenses, Anaplasma and Neo-Rickettsial. Scheffenses affects monocytes, Anaplasma neutrophils and Neo-Rickettsial affects lymphocytes. So in the previous questions where they had mentioned neutrophils, the answer would be Anaplasma. This was either in the morning or afternoon session. So the people who got asked monocytes as a question, the answer becomes Ehrlichia Scheffenses in this case. Very brilliantly asked and very twisted question. And Rickettsial is a topic which is not thoroughly studied for CET, but this time in AIMS INI CET they have really asked a brilliant question. So the next question is immensely image based, and when you see such questions, please don't panic, because if your basics are clear, then I'm sure you will get a correct answer. A 10-year-old boy noticed thread-like worm in stool. Segments of the worm had breadth greater than the length. Which of the following eggs will be found in the stool examination? The left-hand side shows the image of the adult worm, and the 4 options are the eggs. Now let me tell you certain key points before coming to the answer. Broader segment with more breadth is found in D. latum H. nana. D. latum has no suckers. Taenia saginata has suckers but it has no hooklets. Hooklets and suckers both are found in Taenia solium and H. nana. Now let me tell you the actual answer with the help of the image. Now let's try to find out the correct option. If you see the left hand side image, the black lines which you see at the center of the mouth is nothing but the hooklets, and the two disc-like structures left and right में, those are nothing but suckers. Hooklets and suckers with breadth more than length, you know this is a cystode. Now the right hand side options, A is H. nana egg, B is a fertilized egg of Ascaris, C is D. latum because of the operculated structure you can see in the, at the top of the egg, and option D right up there is Enterobius vermicularis. Now when you know these criterias, we just saw that we have ruled out option B Ascaris and option D to chala gaya. Then we are left with H. nana and D. latum. Now यहाँ पे D. latum we saw that it has no suckers. Okay, so your right option is H. nana. This is a very simple thing if you know the answer, but now what happened in the evening session is question को और भी complicated बना दिया by removing that D option of Enterobius vermicularis and उसमें Taenia species का egg डाल दिया. So what happens, you know that I just explained it to you that hooklets and suckers are present in Taenia as well, but it is present in Taenia solium. Taenia saginata is without any suckers. अगर if you know this one criteria, then automatically you will go with the most priority wise. In this case, the more specific becomes still H. nana. A person returns from forest and presents after few days with falling skin lesion on the back. Correct etiological agent is asked here. Options are COVID-19, Rocky Mountain spotted fever, scrub typhus and malaria. If you see in the picture, you can see a typical scab which is also known as eschar. And this eschar of all these four options is typical findings in scrub typhus. And please note that this is also a exactly repeat question from July INI-CET 2021. The next question is, which of the following agent here acts as both antiseptic as well as a disinfectant? The options here are ethanol, glutaraldehyde, orthophthaldehyde and autoclave. Now you need to understand that out of these, glutaraldehyde and orthophthaldehyde, they are high level disinfectants. Autoclave is not a disinfectant, it's a part of it causes sterilization. So the right answer here is ethanol. Why? Because let me explain you what is antiseptic and disinfectant. Antiseptic is when you kill microbes of a living surface, and disinfectant is when you kill those microbes on an inanimate object, that is a non-living object. So in this case, I'll give you an example. So whenever my laboratory staff sits for lunch, they always wipe their mobile with alcohol, and they always even rub their hands with alcohol and then wash them. So you see, ethanol acts both as antiseptic and disinfectant. So with this example, you will not forget it. Glutaraldehyde and orthophthaldehyde, on the other hand, they are highly irritant, and that is why they cannot be used as both. Autoclave does sterilization, and so that is completely out of the picture in this scenario. Patient came to the hospital with complaints of high fever since 5 days, and relatives are giving a complaint that the patient was suffering from altered sensorium with seizure night before. Peripheral smear findings are shown in the next slide. How will you treat the patient? Options are chloroquine, artesunate, doxycycline, primaquine. Now, after reading this, you should know that this is a malaria case. But how will you come to the conclusion? Now, look at this picture. You can see multiple ring forms in those RBCs, along with the typical headphone appearance because of the double chromatin heads. Now, this is very, very classical of falciparum, Plasmodium falciparum. And the treatment for Plasmodium falciparum is nothing but artesunate followed by atoquine proguanil. And the case here was cerebral malaria. The next question is history of trauma 6 weeks ago. Image shows lymphatic spread of lesions. All organisms have the property of lymphatic spread except the options were Sporothrix, Nocardia brasiliensis, Corynebacterium minutissimum in morning session and Staph aureus in the afternoon session. Mycobacterium marinum. Now what happens is, of all the options, Sporothrix, Nocardia and Mycobacterium marinum, they all cause a typical lymphatic lesion. But the option Corynebacterium minutissimum, it causes erythrasma, which is not lymphatic in any nature, and Staph aureus causes something known as botryomycosis, which is not lymphatic at all. Coming to the next question, inclusion body seen in molluscum contagiosum. This is something which is caused by virus, and the image is showing an umbilicated lesions. You should know that there are certain intracytoplasmic inclusions which are seen in conditions such as Henderson-Peterson in molluscum, multinucleated giant cells in herpes, Taurus in yellow fever. Usually if you do these tables that are very important for MCQs, then these MCQs like these are very easy. Like in this case, it's Henderson-Peterson body. Match the following types questions also are asked in INI-CET. In this case, Clara, parietal, dust, Kappa cells are given, and you have to match them accordingly with the tissue they are associated with. So Clara is associated with bronchiole, parietal to stomach fundus, dust cells to lungs, and Kappa cells to liver. These are macrophagous cells, and I have mentioned that in the bracket, but it was not actually mentioned in the exam. So you should know that there are 10 main macrophages and they are associated to 10 organs. Now the next MCQ is from immunology. All of the following are released from Th1 except interleukin 2, interferon gamma, interleukin 4, interleukin 12. Now if you know the basic of immunology, this is a very simple MCQ. Let me put it this way. Th1 produces interferon gamma and interleukin 2. Interferon gamma activates macrophage which increases interleukin 12, and Th2 produces interleukin 4, 5 and 10. So in that way, interleukin 4 here becomes the option, the correct answer, as it is associated with Th2. The next question is, which of the following sterilization method destroys spore? Options are ETO, glyceraldehyde, pasteurization and tyndallization. Now to kill spores, you need a temperature of more than 100. In this case, the correct answer is ETO. Glyceraldehyde is ruled out because it is a type of disinfection, high level disinfection. Pasteurization, the method only is something which occurs at less than 100 degrees Celsius, and tyndallization occurs at 100 degrees Celsius, so it does not directly kill the spores as well. So the correct option, ETO. Coming to another image based question, like influenza virus, which one of these exhibits antigenic shift? Now this same question was asked in the evening session. सिर्फ antigenic shift हटा के वहाँ पे genetic reassortment word add कर दिया गया था. Now in this question, the correct answer is Ebola, because antigenic shift, genetic reassortment, all this happens, most commonly it happens in helical viruses like Coronaviridae, Bunya virus. But if those options are not given to you, for example, Ebola, the left hand side is Ebola, center one is adenovirus, and the right hand side is a bullet shaped rabies virus. So in this case, Ebola would be your preferred answer. Usually such basics as microscope topics also are sometimes ignored, but look at what was asked this time. Microscopic technique that can be utilized to produce high contrast image of transparent specimens such as living cells. Here the keyword is your living cells and high contrast image. What happens? Clear cut, it is phase contrast microscope. We can rule out directly the electron microscopy as an option, because in electron microscopy vacuum is used, and whenever vacuum is used, definitely it is not done on a living cell. Next question is so very easy, because I think somewhere or somehow we have all gone through this. But anyways, SARS or COVID can be detected by all except rapid antigen, RT-PCR, southern blotting, ELISA. Now, southern blotting DNA का किया जाता है, northern blotting RNA, and western blotting protein. So obviously your COVID is Coronaviridae. It is an RNA virus. So naturally southern blotting here is the wrong option. That is why you have this, that is your answer here. Which of the following has been reported in India? भले ये चारों options exotic है, Ebola, West Nile, Hendra, yellow fever, but out of all these, West Nile fever has been reported in India, Ebola Africa, Hendra Australia, and yellow fever Africa. Now we have a immunology question which is directly clinical based, and see how beautifully they have asked for it. Carefully listen to this question. Patient on treatment of secondary syphilis with benzathine penicillin after 6 hours of first dose develops fever, chills, headache and tachycardia. They have also given the diagnosis in the question itself. Jarich Hersheimer's reaction is diagnosed. Cytokines responsible are, let me explain you these points. Now, the treatment that the patient is taking, which is killing the spirochetes, causes release of endotoxin and lipoproteins in the system. These causes cytokines release such as interleukin 6, 8 and TNF alpha, which in turn causes exacerbation of the already existent symptoms. Definitely, if you see the options, then it is obvious that interferon gamma is the correct option here, because it is not involved in the cytokines responsible. So all the best.